Fiber optic is a technology that for most people is used in telecom application. But this is far from being the only application. And medical is one of the applications which is very rapidly growing at the moment. Why? Because fiber optic can transmit laser light. This is probably the main application. So the beauty of fiber optic is that medical lasers are existing for a long time, but with a fiber optic, you can bring the laser spot exactly where you want, that is eventually inside the body of a patient. And this is why fiber optic are now very important for laser, medical laser application. Another interest of fiber optic is to collect the light from the body for diagnosis. And maybe I will talk later about this type of application. And more and more we find medical diagnosis through fiber optic products. Our company, Sedi Ati, is manufacturing 4 main products in the medical field. The first one and the best seller is at the moment vein treatment. We produce a fiber which is connected to a laser, and at the end of this fiber there is a capsule, and this capsule, the function of this capsule is to make a circular emission of the laser light. In other words, when you enter the fiber into the vein, you shoot on the wall of the vein, and such as to collapse the vein, and it is used to treat the big saphenous vein for to remove varicoses. So this is a very, very high number application which is growing in the world. Another product which is interesting, not yet a big application in the world, but very promising, is to cure cancer via photodynamic therapy. And we make a probe. The function of this probe is to emit light in all directions at the end of the fiber. It's a diffuser. So it diffuses the light, and thus you can activate a drug which is going to kill the cancer cells. And finally, another very, very interesting application, which is in a different market, is diagnostic of cancer cells. And we have a very interesting product, which is a WDM, multiplexer, wavelengths multiplexer. The idea is to introduce fiber optic into the body to launch a laser light in a probably cancer region, and the cancer cells have a different fluorescence of the normal cells, and so the cell fluoresces, and with the same fiber we collect the fluorescence light, and we have a component which directs the fluorescence light into another direction than the laser. It directs the collected light to the detector of fluorescence. And with this detection, you can say if it is a cancer or a non-cancer tumor. So the fiber optic market is now for us the fastest growing market in Europe. It is already a very, very large market in the United States and in Europe. It is one of the difficulties is the government regulation for reimbursement of medical expenses, which make it difficult in some countries to develop this market. But because it is sometimes expensive technology, so sometimes it is people cannot get reimbursement by the social security system. But it is a multi-million dollar market at the moment. And we believe that in the future it will be a very extremely large market. And it is, of course, according to the number of people that you have to deal. But for instance, I was talking about the prostate. The number of cases where you have to deal with this disease is tremendous. So we believe that in the future it will be a very large market. Also, diagnosis, optical technology are very interesting, more and more interesting to make diagnosis. So the possibility are very important. So for the moment, our company is making these products mainly in Europe. And the main market for us are Germany, Spain, Italy, and France. And we would like now, with the expertise we have in this product, to explore new market. And we believe India, with a large population, educated population, and is probably a good target for us to develop. We would like to find cooperation with Indian company to try to develop this technology here in India. Okay, probably, yes. It could be made in India. Maybe not all, but part of the product. That would be the best case for us. Would be to make a part of the product which maybe needs more difficulty, because you need a clean room, you need a very strict regulation in the manufacturing. So maybe it's in the beginning more difficult to transfer, but a big part of the product could be made in India. It's my first trip to India, so I haven't seen this product yet, but I believe there is some already, yes.